Good evening, viewers. I just want to talk to you a little bit about this very dreadful disease, which is coronavirus. First of all, let me introduce myself. I'm Dauda Tarawali. I live in the southern part of Sierra Leone. I'm the regional coordinator South for all Muslims and Imams generally. But briefly, I want to talk about 5 or 6 questions. Number one is coronavirus. What is coronavirus? The second one is symptoms. What are the symptoms? The other one is how it's spread. And the other one is also if there is any cure for it. And last but not the least, if we can use antibiotics to cure it. Because some people use antibiotics to cure it. Viewers, as I said, you have to please don't forget to subscribe. Press the how you call it, the ring, and then share. We come to the first question. The first question is coronavirus. Coronavirus, of course, is not a new something. It has occurred in 2003, which is SARS, severe acute respiratory syndrome, which occurred in 2003, and we had about 8,000 affected people, and it killed about 800 people. Again, 2012, we had MERS. Again, it affected 2,500 people. And now we have Corona 2019, which occurred in November last year, 2019. That is why they call it COVID-19, Coronavirus Disease 2019. This particular one is a new strain. That is why, in fact, scientists are working all around the globe to find cure, but they have not got any cure for it for now. That answers the question. But we want to know how actually it affects people. Coronavirus, of course, is the virus that actually spread through droplets from the nose and the mouth, by the saliva we get out, and also from the nose. You see, coronavirus is something that is a dreadful disease. There's no way if you don't take the precautionary measures. Of course, studies have told us all over the world that we are supposed to wash our hands regularly and also to maintain social distancing. What is social distancing? Is 1 meter off from somebody, whether the person is having symptoms or not, you have to maintain that distance. And you make sure that you wash your hands regularly with soap and water purely, and then you make sure if you have a mask, you put on your mask where you have so many people around you. And don't forget to maintain the social distancing. How it spread, like I told you, we get droplets when we are talking, the saliva we get from our mouths. When you sneeze, the droplets that come out of your mouth as a result of your sneeze, it carries the virus. If you have if you are somebody who is infected with this virus, it carries the virus. So for us to be very much protective about it, you have to make sure you keep that distance away from somebody who is affected with this, who is infected with this virus, so that you can keep off away from it, from that person, not to get infected. The other one is whether we have cure. People sometimes tell individuals and tell people to use antibiotics. Antibiotics is, you can only use antibiotics when you are advised by your doctor. But please, I want us to stay away from using antibiotics as a result of, as a means of curing coronavirus. Antibiotics is not for coronavirus. Coronavirus is a virus. It's not a bacteria. Antibiotics, you can only use antibiotics for bacteria, for curing bacteria. You don't use antibiotics for coronavirus. I want us to know that up to this moment, we have not got any cure for coronavirus. There's no cure for it as at now. People are trying to produce vaccines, as we are hearing, but this one, again, we are yet to prove whether it is active or not. But for now, doctors are trying as much as possible, as best as possible, to make sure they apply what I refer to as conservative treatment, which means they put you, if it's a severe case, they put you on respiratory machines that will support you, to give you more oxygen and to give you support, because it has difficult breath. One of the conditions, like I said, in a severe case, when you have coronavirus, commonly you have this, you cough, you have fever, and you have difficult breathing. But in advanced case, you have pain all over the body, you get pain all over the body, and you get, you sneeze very seriously, and you also have this difficult breath. You cannot be able to help yourself except by a way of hospitalization, and maybe you be put on the life support machine. So these are some of the issues that I want you to know. And mind you, you have to subscribe and you press the ring and then you share. Please, we want to get onto you again some other time that will bring another topic that has to do with coronavirus, and we'll educate you about it. But let us stay safe and make sure you take all precautionary measures, as we know this disease indeed is a dreadful disease. It has claimed so many lives. It has claimed so many lives. We are suffering all over the world. We are seeing people dying, and we have to be very much mindful about it and make sure everybody seriously treats this matter as a serious case, so that we prevent ourselves from it. You make sure you wash your hands regularly. If you have your water, you have soap, make sure you wash your hands regularly, and then you get that social distancing, which is 1 meter off, or if possible more than 1 meter, and you make sure don't allow anybody that is severely getting some pains all over the body, and maybe you have a severe respiratory problem, refer that person to hospital so that that person can be tested. If that person is positive, then he can be put in a special isolative system. Let us be mindful that coronavirus is a dreadful disease, it's an invisible killer, and it has claimed so many lives. Please, let us be watchful and let us be mindful. I think we have done our own bit to give you some of the messages we have for you, and we are sure that we'll be coming to you from time to time regularly. And mind you, this channel, I want to tell you about this channel. This channel we call it Enhancing the Essence, which means we are going to talk about religion, we're going to talk about socio-cultural aspects, we're going to talk about health. Today we are talking about health, and when we come back, maybe we'll continue from where we stopped about the coronavirus, and maybe we can also continue some other time with socio-cultural aspects and also religion. As I told you, my name is Dauda Tarawali. I live in the southern part of Sierra Leone, which is Bo, the city of Bo. And of course, don't forget to share, and don't forget to subscribe, and don't forget to share and press the ring. Thank you very much.